Thank you, Governor. Good afternoon, everyone. I will get started with the data for today and for the weekend. We have 32 new cases to announce. We had 73 new cases on Saturday and 46 new cases on Sunday. While we generally do see a slight dip over the weekend usually, it's definitely good news that these numbers are as low as they are while we're continuing to test as many people as we are testing. There are currently 127 people with COVID-19 in the hospital. Of these 127, 21 are in the intensive care unit and 14 are on a ventilator in the ICU. These hospitalization numbers have also been stable and low. Unfortunately, we have 6 new confirmed COVID-19 fatalities to announce for today. Our total increase in fatalities since our last data update on Friday is 18. 7 fatalities were confirmed on Saturday, and 5 were confirmed on Sunday. The majority of these people were in their 80s. 8 of these Rhode Islanders were in their 80s. 1 of them was in their 40s. 3 of these people were in their 50s. 1 of them was in their 60s. 2 of them were in their 70s. And 3 were in their 90s. Our prayers go out to the families of these Rhode Islanders who have passed and to all Rhode Islanders who have passed away. We know that it's not easy for families, and our hearts are with you. Shifting gears, as the governor just shared, Father's Day is next weekend, and we know how important it is to honor and celebrate the dads, grandpas, uncles, and other father figures in our lives. We absolutely want people to do that. And as the governor has shared, we want people to be able to do it safely. We know that people recognize that this Father's Day is going to be a little different than other Father's Days. And we want to support you in being able to still acknowledge and honor the father figures in your lives. Social gathering size is still 15, as you have heard. And it's important to make sure to bring your mask and to wear it where you can. If dad or grandma or grandpa, or other people in your family are either on the older side or have underlying conditions, also consider staying home and consider connecting over the phone or other ways to be able to engage with them and tell them how much you love them safely. As much as we all want to get together, being together in person can be risky for some people. This is why, as much as we don't want this to be the case, in-person visits in the same room are still not allowed at nursing homes and assisted living facilities through phase 2. If you want to connect with someone in a nursing home or assisted living facility, particularly for Father's Day, just because you love them and miss them, there are many different creative approaches that we are encouraging people to explore. For example, we have talked to facilities about safely and quickly doing drive-up visits. This has to entail you calling the nursing home or assisted living facility, making an appointment to be able to see your loved one, and then going at your appointment time to see your loved one while remaining in your car. That is critical. The nursing home or assisted living facility resident would be brought out, but would have to be distanced from the car more than 6 to 10 feet, and additional safety measures must be in place. Wearing masks, keeping windows up, being able to say hello from afar. But through a drive-up visit approach. I want to be clear that not all facilities are going to be able to do this. The layout of a facility's property or other obstacles may prevent this from happening in all instances, so we want to make sure that you continue to engage every other type of way to interact. Other ways that people can connect with their loved ones in nursing homes and assisted living facilities to really show your love by helping them make sure that they stay safe is by sending packages with photos or other handmade items that can really make a difference, doing a virtual visit using FaceTime or one of the video apps that are available, or coordinating the delivery of a special meal or snack for your loved one. We want to support you to continue to demonstrate your love by keeping your loved one safe. That is critical. So to make one final additional point, we have heard from many people who are being told by their employer that after being COVID-19 positive via a test that was done, that they need to be retested before returning to work. Generally speaking, people do not need to be retested to return to work. There are other ways to ensure that COVID-19 is no longer in place and it is safe to return to work. Someone who has COVID-19 by identification through a test or just with symptoms and exposure and they are concerned should isolate, recover safely at home for at least 10 days after their symptoms started. So the day your symptoms started, at least 10 days have to occur where you are recovering safely at home. Once those 10 days have passed, and only if you have been fever-free for 3 full days without taking any fever-reducing medicine, and any respiratory symptoms you've had has improved, then it is okay to come out of isolation, and that means it is safe to go back to work. This recommendation is based on the latest science from the Centers for Disease Control and Prevention. It is an approach that we have been recommending, and I'm sharing now so that everyone can continue to be educated on the safe ways to return to work. Centers for Disease Control and Prevention researchers are finding that the evidence shows that after the 10-day period has occurred, it is unlikely that transmission of COVID-19 takes place any further. We're only recommending to get an actual test to confirm that you've completed COVID-19 to end isolation in very specific situations. For example, if someone is a healthcare provider in a long-term care facility and has the need or is immunocompromised in a particular situation, those are scenarios that we are supporting from the Rhode Island Department of Health standpoint, testing to occur. But for the majority of people, it is acceptable to say that symptoms have resolved once you go through that 10-day period of isolating to recover safely and have 3 days of no fever and your respiratory symptoms have fully resolved. We call that the time-based or symptom-free based approach, and that is something that should be used and is acceptable. So we want to make sure that employees and employers are aware of that approach.